Hello, this is the Plastic Surgery Practice Podcast. I'm your host, Allison Warner. For this episode, we have with us Dr. Sal Pacella, a board-certified plastic surgeon in private practice in the La Jolla and San Diego area. He's here to talk about Fresh Start Surgical Gifts, a San Diego-based national nonprofit that delivers reconstructive and plastic surgery to disadvantaged pediatric patients with physical and cosmetic deformities at no cost to patients or their families. Dr. Pacella, thanks for joining me today.
My pleasure. Thanks for having me.
So before we dive in to talk about Fresh Start, can you tell our listeners about you and kind of where you in your practice?
Sure, absolutely. So I'm originally from New York State, and I trained. I did my plastic surgery residency at the University of Michigan, and shortly after that, I did a couple fellowships. One in cosmetic breast surgery in Los Angeles, and another one in Atlanta. I moved to San Diego in 2008. I'm now the division head of plastic surgery at Scripps Hospitals, one of the biggest health systems in Southern California. And my practice is a large amount of facial surgery, probably about half reconstructive and half cosmetic surgery. So the nice thing about kind of where we are in San Diego, it's very centrally located. We take care of a lot of patients from all over the Southwest, Las Vegas, Los Angeles, etc. And we take care of international patients from Mexico as well. So it's kind of a unique place to be from the standpoint of how we do our philanthropy.
Now, we're here to talk about Fresh Start Surgical Gifts. And as I said, they're a nonprofit that delivers reconstructive and plastic surgery to disadvantaged pediatric patients. Now, recently, they collaborated with the University Health San Antonio for its inaugural surgery weekend, which saw world-renowned surgeons donate their time and expertise to provide medical care to 4 children. Can you talk about what Fresh Start is exactly and what your role with the organization is?
So I think it's helpful to understand a little bit about the history of Fresh Start and how it started. So it's actually a grassroots charity that started in Encinitas, California, just one of the coastal towns here in San Diego. It was started by a craniofacial surgeon, pediatric plastic surgeon named Dr. Dennis Nigro. And he used to go across the border in Tijuana and donate his services and his time for children. And then I think he slowly realized that he could bring a lot to the country by operating on kids in country, but could do a tremendous amount more if he sponsored those children to come to the U.S. and do their surgery and recover here while they have access to world-class care. So the organization grew from just a surgery organization that was done in the office operating room to one that's now done in a major pediatric hospital in the Southwest, Rady Children's Hospital, and through a large clinic. So we had been operating Fresh Start for many, many years just solely out of San Diego. And we quickly realized that the model of this organization is really transferable to many cities. So San Antonio is actually our third location. We have a satellite location in Chicago, on the south side of Chicago, that treats patients internationally that may have deformities that are not covered. And we also treat children that are domestic children that may be underinsured for things like ear surgery or lip surgery or things that have congenital deformities that maybe insurance may not cover. San Antonio is a similar model, obviously, with volunteer surgeons that donate their time, and the operating rooms donate their time and resources, and it's really got a global influence across the world.
Well, you're a member of the volunteer surgical team. Can you talk about what that involvement looks like?
Sure. So in San Diego, there's probably a core group of 6 to 7 surgeons, all of different subspecialties, that assist with what we call surgery weekend. So I am a plastic surgeon by training. I have a special interest in oculoplastic surgery or eyelid reconstruction. So I tend to do a lot of the surgeries that involve reconstruction in and around the eyelid or orbit. I work with a pediatric ophthalmologist, Dr. Greg Ostro, who's one of our directors as well, and we may collaborate with cases for children. We have a subspecialist who concentrates on ears. We have another subspecialist who may concentrate on breast surgery. So among all of our specialists, we're really able to offer the entire gamut of plastic surgery from a reconstructive standpoint. So getting back to the surgery weekend, so the way the organization is structured, so we have one of these surgery weekends every 6 to 8 weeks or so. And what that entails is prior to the weekend, several weeks before, we have a meeting called the Medical Program Committee meeting where all of our surgeons get together and we talk about potential prospective patients. So we have a big outreach community program where patients from all over the world can apply. Their applications are translated for our group in English. They'll send in photographs, they'll send in images, they'll send in any radiology, and the medical program committee will decide whether or not they're appropriate candidate for surgery. So from there, if they're accepted into the program, they'll be sponsored to travel to the U.S. They'll be sponsored with transportation and have their surgery here and recovery here. And when it's safe to head back to their home country or home city, they do so without any risk.
What types of cases have you worked on that have really stood out to you personally?
So quite a few throughout the year. So I mean the stories and the difficulties of some of these children really kind of stand out at you. So early on in my career with Fresh Start, I took care of a young girl from Ukraine who was born with a congenital eyelid deformity where her eyelids did not close all the way. And you can imagine, the ridicule and the ostracization that would occur for somebody like that through their teenage years. So we helped put her eyelids back together to raise lid positions so that there's a level of normality for her to get back into life. And she had her surgery here and went back. One of our star patients in the Fresh Start surgical groups, Fresh Start Surgical Gifts program is a gentleman by the name of Beloved. He's a gentleman from Africa who, unfortunately, as a young child, picked up a landmine and this exploded in his face. Just a tragic, horrific accident. He was originally cared for in country and then basically transferred to the U.S. for his acute care. Several years after this, he approached our organization when he was about, I think, 13 years old to undergo the end stages of reconstructive jaw surgery, dental implants, etc. So he's a gentleman I've personally operated on probably about 10 times throughout the years, and he's a shining example of just what hard work and dedication will do. So he has since moved to the United States. He has gotten a college degree. He's actively pursuing his citizenship to the United States, and he married a young gal and has a baby on the way. So, really fantastic story.
For those who are interested in getting involved, what are you guys looking for in terms of volunteers, and what does it take to get started on getting involved?
Great question. And I would say that our volunteer group is not limited to just doctors, nurses, and medical personnel. So if you're a medical personnel, we're always in need of volunteer surgeons, volunteer nurses to not only work the operating rooms, but work the clinics. If you're a surgical tech or medical assistant, there's a huge need for that as well to get the rooms prepped and the instruments handled, etc. But if you are a non-medical personnel, we have just as unique of a need. We're always in need of clerical support for patients to coordinate their trips back and forth. We're always in need of folks to support the surgery weekend. Our volunteers, we like to feed them and treat them well so they come back and stay with the organization. So we're always in need of folks kind of running point and transferring people back and forth and bringing food, etc. So really, it's just a matter of applying to the organization for volunteerism.
And then if it's a plastic surgeon, what would you say as a peer, how does the time commitment here and just the resource commitment look for you?
So the thing I love about Fresh Start is it is an opportunity as a surgeon to work with colleagues in the community that I may not ever see in my private practice. So, for example, we approach this as a very team oriented case. So, we may have 2, 3 surgeons operating at the time. And we do these surgeries on a weekend. So, it's very non disruptive to your family life if you have young kids, etc. just a few hours on a Saturday or whenever the case can be completed. We'll then see the patients again on Sunday morning and perhaps see some patients in the office on Sunday morning for an evaluation. Many times when we do mission work that's out of country, you're traveling a large distance and being out of town for a week, and that can be disruptive to your practice and disruptive to your family life. So this is a unique way to really give back to the community, the global community, and really have it integrate into your life. The final thing I'll say about that is, we live in a world in medicine that is overrun by technology and medical records and insurance companies, and there's frustrations with billing and the entirety of medicine. The wonderful thing about Fresh Start is all that goes on the wayside, and we are uniquely and continuously reminded that the most important aspect of what we do as surgeons is the doctor-patient relationship, and Fresh Start is a purity of the doctor-patient relationship, and that's what I really admire about working with the organization.
We talked about doctors getting involved, but what if a hospital or surgical center is interested in partnering with Fresh Start?
So right now, our mission is to really work with the high end Rady Children's Hospital, and the beauty of that is where patients are exposed to pediatric specialists, pediatric anesthesiologists, etc. Now, years ago, we used to do our surgeries out of an office surgery center, and although that was great for what we did at the time, we sort of outgrew the outpatient setting. And now we have a very unique relationship with Rady Children's Hospital, and it works fairly well. I think as I look to the future of Fresh Start, there will be certainly opportunities for partnerships and new satellite clinics. And it's just a matter of getting involved with whatever pediatric hospital is in whatever host city we are operating in.
What would your final message be to any plastic surgeons, any of your peers who are listening to this, who are, thinking about getting involved or looking for a way to give back?
So I would say that, we're always in need of a dedicated surgeon or a dedicated individual. And, this is an opportunity to really get back to that doctor-patient relationship as I described. And that's clearly important. But another point I'd like to make with the organization is very unique to charities in general. Many times, any sort of philanthropy organization or charity, there's certain operating expenses that have to be covered by the donations. Fresh Start is unique in the fact that we had some very, very generous donors early on in the infancy of the organization. We have a very large endowment, and the interest on that endowment is able to pay for all our administrative overhead. So what that means is that when you donate $1 for Fresh Start surgical gifts, 100% of that dollar goes to patient care, and that's very unique from what I've seen with philanthropy organizations in the past.
So, what's ahead for you this year with Fresh Start?
So quite a bit, actually. We have quite a few cases on the agenda here. I'm in the midst of working with my colleague Asa Morton, who's an ophthalmologic plastic surgeon. We're rebuilding an eye socket for a gentleman who's out of Colombia, a young 14-year-old guy named Juan. He's been back and forth a couple times for our surgeries. I'm also going to be caring for, in a few short weeks, a young girl from Tijuana. She's 16. She's had extensive body surface area wounds throughout her chest and abdomen, and we're going to hopefully do some expansion of her regular skin in order to cut out some of that burn skin and replace it. So a lot of sort of extensive surgery and multiple surgeries on the agenda in the next few months.
Well, I can tell that you're really passionate about this and really excited about the work you have ahead. So, thank you so much for taking the time to talk to me about Fresh Start surgical gifts and with our listeners.
My pleasure. Thank you for having us.
As always, thank you for joining us. And be sure to subscribe to the Plastic Surgery Practice podcast to keep up with the latest episodes. And also, please check out plasticsurgerypractice.com for the latest industry news. Until next time, take care.